routine during the time designated for communication from the floor. The board will receive communication but does not respond to individuals during the...
Apologize. I would like to ask your permission to add a couple of report items to our agenda. Under the superintendent's report, I'd like to add a B, which would be an enrollment report, and a C, which would be a report to you about our CVIS application.
All right, thank you. Okay, communications. Do we have a student report today?
Hi, my name is Lupita Nunez, and I'm Vice President from ASBEC, from our student government. So I heard that we haven't had, oh, sorry.
You can move the mic a little. If you, there you go.
So last month, we didn't have a student representative. So we had our snowball dance on the 18th. We also had our finals on the 23rd and the 25th. Then for this month, we have on Wednesday, this Wednesday, we will have a drama showcase at CHS, and also we are having our Willy Wonka play from February 6th through the 8th and February 12th to the 15th. We are also having an astronaut coming to all the schools on the 24th to the 26th. And we also have cabaret on March 1st at 7 p.m. And that's it. Thank you.
Thank you. This moves us to communications from the floor, public comments. Becky Nordfeld and lab partner.
I could just let him talk. Yes, thanks for the opportunity. My name is Becky Northhead. I'm a counselor at the high school. And I have three things, and I'm wearing different hats for each of them. One of them, just a thank you to the school board and the district's negotiating team, as well as our negotiations team. A thank you for just getting the job done and allowing us to move on. Sorry. As the past CEA president, I know that that's a lot of work, more than I can imagine, and we appreciate it. Number two, wanted to talk to you as a counselor and as somebody who used to be a teacher in the high school and district-wide, just a thought about class sizes and caseload. The high school now has over 900 students. I'm one of two counselors. I'm very grateful that I'm now one of two instead of one and a half. But that still leaves me a caseload of about 470 students. And honestly, I struggle to do what I need to do. I know I'm not meeting the needs of all of the students in our building. But it's not just about counseling, it's about the kids in the classes. When I first moved into counseling at Central High School, if I was putting kid number 32 in a teacher's class, they were screaming at me. And I'm not joking. I had to beg and plead and ask for forgiveness when I put number 32 in. Now if they have a class of 32, they're thanking me that it's small. And we know that it's not small. And when, as people who look in from the outside, maybe looking at an average class size, I think it's important to remember that that's an average, and it's factoring in things such as an ELD 1 class that might have 7 kids, or a special ed class that might have 15. And in reality, there are classes over 40, and most of our classes are 35, 36, 37. And that's for the majority of our teachers. And it can be embarrassing as a teacher, I believe, when a parent calls you to ask about their kid and you're trying to figure out which of the 200 that kid is that's on your caseload at the high school level. And I know the same thing is at the middle school, and I know the same thing is at the elementary school. Which brings me to my last point. I have 2 children. This little guy, Andrew, he's in the 1st grade at MES. We love MES. We have appreciated the teachers at MES. We have a 3rd grader also at MES, and we've had a wonderful experience. But I will say that it has been a frustrating experience for us. Before we started the right size process, my daughter's 1st grade class had on any given day, it might be 32, it might be 31. And every time she told me she had a new kid, I just cringed and prayed that one had left. And that's true. And after the right size, my son, now in first grade, has 30 kids in his class. And some days I think it's 31, depending on what's going on. And maybe that doesn't sound too horrible to some, I hope that it does. But if you think about that class and the 30 kids that are in there, they are not all English as their first language speakers. They're all not regular education. We have a lot of high need kids in our district, and I know that as a counselor every single day. Whether they are struggling with language development, whether they are living in poverty, whether their parents are in jail. I mean, we have an amazing amount of dysfunction in families and poverty and sadness in this community. And when that teacher is sitting in that classroom with 30 kids, they might as well have 50 kids in there by the time you meet the level of all of those kids' needs. And I know in this little guy's example with 30 in the class, it's a blended 1-2 class, so the needs are already great. And once you factor in all those other things, it's a real struggle for his teacher, who is amazing, and we love her. And we worked pretty hard to get our son in her class. And so for us as parents, my husband, we're pretty fortunate that we work for the district, we know the system, we know how to get help. We've hired a personal tutor for our son, he struggles, and we're getting the help because we know how to do that. But a lot of parents don't know how to do that. They don't know how to get a tutor. They don't know how to advocate for their parents, or they're not comfortable, is what I should say, advocating for their students on a daily basis. So now that our contract is settled, and that was a big thing, my new passion is class sizes, and that's for all of the kids that I serve on a daily basis, but it's for my own children as well. And I'll just close in saying that my husband and I this year really honestly considered sending our son to Sandy Ann Christian. And it was really painful for us as 2 Central School District employees to think about that option. And it was more than just thinking about it. We looked at it, we figured out our finances, we figured out we could do it. And we met with Dory from MES, talked about our son's needs. She was wonderful, she helped us, and we said, we're gonna do 1 year, and we're grateful to have the teacher that we have, because we felt bad about that, but honestly, that's where we are, and probably other parents too. When you know, no matter how wonderful that teacher is, if there's too many kids in there, they can only do so much. So I pray that that's our next big objective in this district, and that we stick with trying to lower class sizes. Thank you. Thank
you. Ben Gorman.
This is the board packet, not what I'm going to be reading. I'm sure you're all very grateful to see me not here with a 7-page prepared statement. So a couple things I just want to share with you. First of all, Rich and Lissa and I met today and went over the contract, and you'll be glad to hear we didn't disagree about anything. So I think we're done. Yes. So I'm here to thank the district's negotiating team. Those folks don't really have a constituency that thanks them other than you, and they really deserve your thanks. Kathy, Rich, Cease, Perry, Steve, and Carmen/Lissa put in a lot of time, did a lot of hard work, and we especially want to thank those folks for sticking around on that last meeting, staying much later than they wanted to stay, and getting it done. And that meant a lot. I think that's what made it possible. So thanks to that team. I'd also like to thank the board for the joint press release that will be, hitting the papers soon. But the board agreed to a joint press release that committed to class size, and as you just heard, that's really important to our teachers and our staff. And so that meant a lot, and we just want to thank you for, committing to make that a priority in the next year. We appreciate that. Lastly, we are going to be, the CEA, are going to be really active in the next year in both lobbying the legislature and gathering signatures for a ballot initiative to deal with the funding crisis that causes a lot of our class size. And so I just want to invite you folks, along with the OEA, the OSBA, they're on board. We want to invite you to participate with us so that we're not always fighting over a smaller and smaller and smaller slice of the pie. and so that we can say, this is a priority to all Oregonians. So we want to invite you to be a part of that with us so that we can be working together again. So thank you very much.
Thank you. Okay, that moves us to our administrative reports. Mr. Jamal, is that correct? About school-based health center?
Thank you for having us. My name is Brent DeMoe. I work for Polk County. I'm the manager of a department called Family and Community Outreach. And next to me is Dave Guile. He's going to talk a little bit, I'll do kind of the intro, and he's the brains of the operation, so he'll have that good information. You guys have some materials in your packet, and Dave is going to go over those, not in great detail, but we'll hit the highlights. And we're here to talk a little bit about the planning process for a school-based health center, possibly in the Central School District area. So let me start out by saying the county received a planning grant in the fall of 2013 to look at the feasibility of having a school-based health center somewhere in Polk County. Currently, there are no school-based health centers in either Polk County or Marion County, for that matter. But there are 63 school-based health centers across the state in Oregon right now. School-based health centers have a lot of benefits to the district, and we're going to get to some specific data in just a little bit. But in general, we're talking about better attendance, better health outcomes for students, less time off work for parents, less time out of school for students, just kind of that overall better health. Health centers could have a mental health component, a physical health component, and a dental component. And as we're planning, we're looking at all three of those for Polk County. One of the things that we hear and what people hear across the state is transportation is also a pretty big barrier for getting kids to quality health care. That's one of the things that we're looking at addressing in this area as well. So I mentioned that we're looking in the county. The planning grant is to look at all of the districts in the county, but at this point in the planning phase, we've had a lot of readiness with the Central School District, and there's a couple reasons for that. The first one has to do with definitely some support from the administration and from district staff, and hopefully this board as well. Also the community. We're going to share some survey results we have. There's a facility that's already been identified that could really work well for a school-based health center. And we've also just heard that there's a lot of need in the Monmouth Independence area. So I'm going to turn this over to Mr. Guile, and he's going to talk a little bit more about some of the handouts and some of the data that we have selected. I also just wanted to say that Dave does not work for the county. He is a consultant. Dave Guile and Stacy Chance are the consultants that we hired to look at the feasibility of doing this in the central area. Dave.
Good evening. As Brent said, my name's Dave Guile. I actually live in Kaiser, but started my teaching career over here in Polk County at Whitworth Elementary in Dallas a long time ago, and loved this area. Went to school in Western Oregon, OCE at that time, if any of you were around in those days. So it's really good to be here and be working with this project. As Brent said, this grant, it's a very unique grant from the state because it does two things at the same time. It looks at the feasibility of opening a school-based health center, and at the same time does the preliminary planning towards opening a school-based health center. And the reason for that is that you can't really determine the feasibility without having some of the planning in place. And the state actually requires that there are 4 things that must be done, that when Stacy and I write our report in June, we have to be able to say, yes, these are available. One of them is to identify the facility. And as Brent mentioned, there is a possible facility here in Central School District, and it's that building that is kitty corner from the high school. It's at 1601 Monmouth Avenue. That building, when it was constructed in the 90s, I've looked at the original floor plans, and on one half of it, it actually had 4 separate rooms that later on the walls were removed and a computer lab was in there. Those 4 rooms actually could become exam rooms, but it would need the walls put back in, you know, we'd have to look at the plumbing, so there are steps to take. But is there a potential facility? The answer right now is yes. What that would look like, though, as it goes down the road, that has to be sorted out with the district staff to really determine if it's going to be feasible. So facility is one. Having a medical sponsor is two. And so as part of this project, what Stacy and I have done is gone out and we've had conversations with West Valley Hospital, Salem Health, Northwest Human Services to see is there an agency, and it actually could be the county public health agency that would be the medical sponsor. And that, again, is still in the sorting out stage, but we've had the initial conversations with those various groups to see if it's a possibility. We also have to be able to meet all the state standards, and there's a big packet of those, but we decided tonight, in the interest of time, not to go through 19 pages of state standards, but those all have to be met, and they look at what services need to be provided. There's a minimum number of hours that they have to be open, which is 15 per week is the minimum. Most are open more than that. And then the final component is we have to develop a 3-year business plan to show that it's fiscally can be maintained, that it'll be sustainable. If we can show that all 4 of those are reasonably in place or can be developed, then the partners would sign agreements, memorandums of understanding, and it could move forward. And then from that point, the state would commit $60,000 a year towards the project. But really, part of it is, is there enough need to have enough patients? And even though it's called school-based health center, the ones that are operating the best are open to more than just school-age kids. They at least go to the school kids and their families. Many of them also allow staff to utilize the center, and the ones that are really doing well actually are to the broad community. And so that is something that would get sorted out, and you as a board would have input into, who do we really want to serve here? And in the case of school-age children, one of your roles is to decide, well, how do those kids get there? How do they access it? What kind of parent notification happens? All of that gets worked out initially in the planning phase, and eventually parts of those have to become policy with the school district. The state will not accept the plan without policies that show that the school district really is still caring for their kids. They're not going to let 5-year-olds walk from MES to Central High School to access the health center. In your packet, we've gone ahead and put in just a few things. One is an information sheet. We provide these once a month. This is publication 3. And on one side is just a set of question and answers. I'm not going to take your time. You can certainly read that on your own. But on the back of that is a list of the planning committee. That's another requirement of the state, is that as you go through this, you must have a planning committee. And you can see there's some county people and community people and school district people. You'll see Capital Dental is on there because, as Brent mentioned, one of the things we would like to do is have dental services offered through this if it moves forward. And we listed some of the February activities. Now, a lot of the activities right now are gathering data. And so we've started some community data gathering. We've got 50 surveys back so far. The high school is sending out parent surveys, and we have a staff survey that is ready to go online. We've not administered that, but we did do a survey with the high school students, and that's actually, if you skip the page that talks about the benefits, and you just go back a little bit there, you can see the results of the survey that was done with the students. It was anonymous. We had 734 kids, so a pretty high percentage of the high school kids filled them out. And you'll just see some of the things that we're trying to find out. One of those is how many kids have to leave the community to get health care. And so you can see that well over half of the kids go somewhere else. And the implication of that actually ends up in one of the other charts, which is how much school then do you miss if you have to go to a health appointment. And that is one of the questions on the parent survey as well, because some of those parents are missing work to take those kids to those appointments. It also, in those charts, it shows, you know, what are some of the barriers for kids getting appointments, at least from their perspective. And you'll see, you know, some of the biggest one is they think the services cost too much, but having a long wait for an appointment, that's a big deal to the kids. And you can look through the rest of those. You can see that almost all the kids saw a provider in the first 6 months of school. And then we did ask how much school do you usually miss if you go to an appointment. And about a third of them miss 1 to 2 periods, and about a third miss half a day, and about a third miss half or more than half to all the day. And then the chart down below asks them what kinds of services, and that listing of services, those are the basic services that a school-based health center offers. And I know when I was asked about taking this project on, my first vision of a school-based health center was everything bad I'd ever heard about a school-based health center. But what I've since found out is each state is unique because the state sets rules about what they can and cannot do. And this list of services is essentially the basic list of what you have to do. So some people think, well, you know, that's where every kid's going to go to get a condom. Well, that's not true in Oregon. Now, that may be true in some states, and in Oregon, that could be an option if all the parties, the school district, the medical sponsor, and everybody else agreed to that. But if you don't all agree to that, then that's not a service that would be provided. So what we're doing right now then is working up towards a June 30th deadline where we have to give a report. Really, I'm hoping to do this about June 10th to 15th to be able to give a report to the state and say, yes, it appears that Central School District, Polk County, and these partners are all ready to move forward, or they're really not ready to move forward. If in this case, if it was close, the state will allow that second year, some of that time and some of that money to finish the project. So if you're pretty close, they'd go ahead and say, go ahead, keep going, and my guess is, I mean, they've already budgeted the money, so my guess is they would go ahead and allow that. But we have a lot of data still to gather. Tomorrow I'm meeting with student government kids at the high school. We have meetings set up with the Chamber of Commerce, with the City Council. We're arranging one with the Ministerial Association. I'm going to the Latino parent meeting tomorrow night, and we're going to do a survey there. So we're still gathering a lot of data. So it isn't tonight where we can say, absolutely, here are the things that that you need to know. But we wanted to make sure you had a good idea of where this process is. If it does move forward, your role really becomes looking at the facility use and making sure you're good to go with that, approving the policies that affect the students who would be using the services, being involved in any discussion about any services beyond the basic services, and then providing direction and support as we move forward. I know Buzz and Greg are very interested in looking at the career opportunities for kids in the high school. So for a student who wants to go into the medical field to do some kind of little internship with that or some kind of project, certainly that would be a possibility. We're looking at the OHSU program at Western Oregon to see if they would like to partner with us and perhaps make that a practicum site for their students. So there are a lot of things that still are yet to be uncovered. And Brent and I are certainly willing to come back at a future meeting, bring additional information as we have it. Obviously, Buzz will get it all, and he also could share it with you. And I do want to say I've been very impressed with the support of the administration. Obviously, not only have you all and them supported your teachers in your contract negotiations, but the support that we've felt on this project, helping us gather information, has been outstanding as well. At that, Brent and I'd be happy to answer any questions.
Jerry, did you have a question?
Yes, I have several, but I'll just ask them one at a time. You say the state's gonna contribute $60,000 to run this thing, and you're talking about with a doctor or two, dentist, nurse. How much is the cost of the whole project per year above the 60,000? That's kind of chump change from the state.
And you're exactly right about that. Right now, we're working with 3 different models. One is a 15-hour a week, one's a 21-hour a week, and one's a 26-hour a week one. And a lot of it depends on what the medical sponsor is willing to bring to the table. So if the medical, because the biggest cost is in the staffing. And so if the medical sponsor, because they can bill through OHP or through private insurance, and they can cover some kids then that have no insurance, they're going to build that in. And what we've seen with other ones across the state is that for about the first 2 years, the medical sponsor is going to have to pick up the difference in costs because they're generally not going to be financially even for the first 2 years. For some reason, by about year 3, there's enough billable services that are happening that the ones that are making it, they make it in the black around year 3. Some of those dollars, by the way, are not just medical dollars, they're mental health dollars, because mental health can be billed through this as well, and that is another component that we're partnering to look at right now. The county probably will be the main provider of that. But the other good thing about having partners is a big cost of any center is electronic medical records, and whoever the partner is, that's who will bring that component. If you had to buy that, it'd be about $110,000 just for that.
John, did you have a question?
I was just curious about the longevity of this program overall. You mentioned there were 60-some other health centers in the state. How long has this been in place? Are they well established now?
The Deschutes County one opened in 2000, and the Columbia County one opened in 2001. Those are a couple we've had contact with. This year there are 12 that are in the planning feasibility phase. We do know of 2 that have closed in the last 2 years, both of them because of finances is the primary reason. They just didn't have enough outreach to bring in enough billable hours. They served a decent number of kids, but the decent number of kids they didn't open to the community, and they really didn't have enough insurance billing to make it. And the doctors who were involved finally pulled the plug and said, we're not going to be the medical provider anymore. But they've been around for about 12 years.
And if I can just add to that, Jerry and Don, those are good questions. And I think what I hear you asking is, what are the implications for the school district? Are we going to have to be footing the bill for this thing for a long time? Is that kind of what I hear you saying as well? One of the things that Dave and Stacy are committed to is this feasibility study is a true, honest feasibility study on, does it look like this is going to work after that initial first 3 years? The medical sponsor's got to be able to come to the table and see somehow being in the black in the near future. If there's mental health services and public health services there, they have to look for that as well, because no one entity can just foot the bill for this, in the next few years. So we'll be taking a very serious look on the feasibility side and making sure that it's something that can sustain.
Anyone else? Jerry?
No, go ahead, Jen. I'll get mine.
Mine is basically just a couple comments. One, I was home enough tonight to open up very quickly. As a parent of a high schooler, I did get my survey in the mail today, and I'll be doing that and getting that back into the school. I look forward to learning more about what this is going to look like and the possibilities. What I know about Polk County Mental Health is that they are overburdened, so to be able to bring somebody into our community or a couple somebodies for our kids, I think is very exciting. We've talked about how we're bringing in the kids from that facility back into our school and providing those services, and we're talking about doing that in a whole family, with lots of providers, and I think that looks like it's going to be go hand in hand with what we're doing here. And also, it was interesting that the physical exams showed up on that for the kids, because the last couple years I've been involved with the school where we have brought in a doctor to do the sports physicals and stuff, and that is a huge need for our kids to be able to take part in school activities. And I think that there's lots of these things where it's going to be great for our kids. I think as a parent, there are some things that I would have questions about and want to learn more about, and I think that that's important, and we need to ask those questions and be, and feel as though we can get that information. But there's lots of these things that are going to be good.
Jerry, did you have another question?
I got 2 or 3, but I'll just ask one to start with. Well, just part of one, the doctors down the street that are already in business, are they going to feel okay about losing some of their business to tax-supported competition? And the other question I have, and then I'll shut up, maybe. You said that, because I've heard from several people in the community about this thing, and several of them, parents have asked about, eventually that would be a thing to pass out contraceptives. And the people that I've talked to, the thought of that really sticks in their craw. They don't want that. If a kid wants contraceptives, they can walk across the street, high school pharmacy, and buy it on their own without having the school sanctioning that kind of stuff. That should be an individual family, individual values, morals, etc. So I would be totally against that part of it, but also the part of the doctors, like there's an eye clinic right over here and several doctors right down here towards the end of the street, and so on. Are they okay with the competition, or are they going to be part of it, or how does that work?
Both of those are very good questions. Let me handle the contraceptive one again. Right now, school-based health centers in Oregon are not required to hand out contraceptives. And the only way that happens if the school board signs on as a partner in a school-based health center is if you all agree to it. Now there have been, there's been one that I found in Oregon where the school board did sign on to that, and that was Vernonia. And in Vernonia, they decided that because of certain health considerations for the kids in terms of sexually transmitted diseases, that it made sense for their community. But unless you sign on to that, you can certainly tell people that that is not a requirement of school-based health centers. Now, the competition piece is real interesting because it certainly is possible that some medical providers could lose a patient. A family could decide, you know what, I can get that appointment quicker at the center and they can bill my insurance just as easily, so I'm going to go there. On the flip side of that, though, these centers really, these are not full meal deal operations. And what they do, what a center does is they develop a referral memorandum with local providers. So if they see a child or any patient where they go, that's not a service, we're not equipped to deal with that. So that same physician who maybe lost some business, it is possible, to the center also may gain some business, because here's a family that wasn't even being seen before by anybody. They've got a medical need. It's not one the center can deal with, but they can refer them to Dr. whomever. And in terms of vision, that isn't one of the things that the center does provide. So vision could be another partnership, but it isn't one we've explored at this point.
I think all that I would add to that, Jerry, is remembering that about 60% of the kids are actually seeking medical or dental care somewhere outside of this community. That could be because of their insurance. It could also be because they're on the Oregon Health Plan and there aren't providers in the community that are accepting new patients for Oregon Health Plan. So we're going to focus a lot of our efforts on serving the underinsured and uninsured families as well in the community that they live in.
I just want to let you all know, because of my relationships with some of the funders in the state, Ford Family Foundation, particularly my Memorial Trust, that rural children's health is a huge priority for those foundations, and the opportunity to bring health care, particularly dental care, is very big. They do a lot of those private foundation grants for these kinds of facilities. I don't know specifically for school-based health, but it is a huge funding priority for them. So I'm sure we would be able to talk to them about grant opportunities, both for the facility and for operations.
February 7th at 11 o'clock. We're already meeting with Ford Foundation.
I also would point out at the COSA convention and at OSBA as well, the concern with regards to the health of the pre-K to kindergarten kids that are coming to us, and the difference in a healthy student as compared to an unhealthy student. And there's significant research around that and data indicating that being able to provide health care and have the students be healthy is directly related to their opportunity to be successful.
Anyone else?
Thank you so much.
Thank you very much.
Thank you. Okay, Mr. Baldwin? School safety?
Sorry we took so much of your time.
Good evening. I'm bringing Chief Olson with me up here so he can answer the tough questions. Yeah, I would like to talk to you about our school safety protocols and kind of some of the work that we've been doing. I'd like to update you. I guess it was August or so, Chief Olson sent me an email and invited me to go along to a conference up in Hillsboro, and it was going to be on school response protocol stuff, like state of the art or something that was needed in our community. And so we went to look at this program, and it's by the I Love You Guys Foundation. And I know I left last time before I could finish that. I just gave you the cover sheet, had a website on it. And so I wanted to kind of follow up a little bit with that tonight. So I have some handouts for you to follow along and kind of just share a little bit more about it. We'll go this way. So what I handed you there is on the website, all these materials you're able to go on and print them for use. There is a part where we're supposed to agree and email them about that you are using their program to get consent for these forms, as long as you don't alter them and use them with fidelity, kind of a thing. So that's something we have not done yet, but are in the planning stages of, if we are going to adopt and go do that, then we would definitely do that piece there. On page 6 is the introduction to the program, and the student response protocol system here. As you can see on the front, it's for responding to lockout, lockdown, evacuate, and shelter types of situations. It says here that it's a replacement. It's not a replacement, it's an enhancement to your existing safety plans. And so it has very detailed, simplified strategies for those 4 areas: lockout, lockdown, evacuate, and shelter. And I'm going to let Chief Olson just talk a little bit about our conversations that we've had about what we're doing at the school.
one of the reasons that the fire district really wants to encourage this program is that it's based on incident command system, which is after 9/11, the federal government pushed through Homeland Security and the incident command system, and while law enforcement and EMS and fire suppression, and as well as the military, work daily with the incident command system, I think it's good to have that opportunity to broaden that out to the school districts, as there will be a joint exercise. It's a joint activity. I mean, we've seen with the recent shootings and all of the different events that have been going on, how integrated the command system is with unified command centers, points. It's just a great program to sit there, and that's where this is based in that. So, and for us to be able to utilize an all-encompassing program, not just for a fire drill. I know that's what for years we've preached, fire drills, fire drills, fire drills. This program has, I don't remember the exact numbers, but they were talking about the number of students that have been injured and died from fire in schools over the last 20 years, and that number is 0. And the number of students that have died while being under fire in schools is over 200. And therefore, there's a flaw in our system where we're focusing, and the fire district wants to work well because we're also involved in EMS, and we're all parents, and we're all involved for the safety of the community, and therefore, I think it's good to wrap this all up into one big plan. And this standard response protocol does encompass everything from lockout, securing the students into the building, lock down if there was a threat inside the building, to locking them down into their classrooms, the evacuation portion, as well as sheltering in place, whether it's for whatever emergency there is. So this program protocol does encompass all types of emergencies. I say that and something will happen, but all emergencies that we can come up with so far.
Yep, and so on page 8, as in a nutshell, it kind of goes through the 4 systems that Neil just talked about. Again, it's really simplified, and all the support materials are in here for this. So what are we doing with this stuff? Well, what we're doing is just looking at how we can enhance our current systems that we have in the schools and get a more unified response. So all the elementaries, junior high, high school have a similar thing. We're training parents and students in a similar fashion. Not every building is inventing a wheel, so to speak. So we've been meeting a couple of times this fall, trying to look through what makes sense, what do we need to do, talk through. There seems to be a lot that comes up in our meetings. Well, what about this and that? And so we're looking for those answers and going through it. So I'm glad to have a team. I've used Monmouth and Independence Police Departments also, along with Chief Olson. So we're ready to really just, I think we're ready to set the stage and start getting some real planning and look at these materials and start meeting with the other principals and looking at their systems and evaluating that. What was interesting to find out is in this process, after an event at a school, there's a thing that they talk about is reunification, how you get the students back with the parents. And that's just new thinking. And as far as our building, we haven't really had plans like that, but it's really evident that that is state-of-the-art, what's going on, be smart about it. It reduces the impact to the families if you have a better laid plan on how to get those families back together, it's going to ease everybody's stress through an emotional event like that. So we actually have a fortunate thing we just put on the calendar today. We're going to do a mock accident in May on the school site. And so part of that will be checking our systems in place as we start rolling this out and looking at setting these things up. And the reunification part will be something that we'll need to test. We don't have that box built and all those materials, but on this site, it has a list of what you're supposed to use. And so we're excited about having a performance day and get us involved and getting some things done. So questions?
John?
So do we do, you mentioned fire drills, do we do or have we done like lockdown drills and stuff in recent years?
Yes.
Okay.
All the schools do lockdown drills, and what we want to do is make sure that we're all doing them in a similar fashion and are answering these situations similar fashion.
So we have most of this in place, and now we're gonna add this layer of consistency.
We're going to look at it through this lens and see if there's a way to work some smarter, streamline some things. There's some, we going through ours, we found some old practices that don't make sense anymore.
There are some components down, the unification component is a component that a lot of people have stumbled on. Excuse me, and so our plans in the past were needed to be upgraded significantly, and this hopefully is the first step in getting those updated in that fashion.
Brett, what was it about this program that led you to believe it was the best for the district? I know there's other programs
Neil
out there.
endorsed it, so, no. I think really it was just the presentation, being there, the simplicity of it, the thoroughness of the whole package. These materials they're really committed. The guy who developed this program lost a daughter in a Colorado school hostage situation, and so it's his mission, and he's just trying to get CERT and fire and police and everybody to work together, and so, you know, it just made sense.
I think another component of that, Jen, is that of all the programs, it's the most consistent at levels. It's the most similar elementary, middle, and high as compared to.
Change between the levels.
Yes.
That is one of the things, and with law enforcement, and you know, we've taught our kids to come out, you know, in fire drills, and they just come out. Well, with law enforcement, they want to see hands, you know, and it's not practical for us to have the students come out with their hands in the air. So one of the things that they've incorporated is from the elementary schools is the kids hold hands. Well, it doesn't matter if your hands are up or out to the side or where, as long as law enforcement can see your hands. And so that's one of the things. But what sold me on this program was not necessarily in priority order, but the materials are free, so that was good. It was easy for me to access this. It started in Colorado several years ago, and it is now, I believe, utilized in almost, there's a couple thousand school districts across the country, almost the entire state of Colorado, most of the state of Florida, I believe. So it's a broadly used program. And again, my big thing as an incident command trainer is that it is based on the National Incident Command System. So the National Incident Management System, which we can bring anybody in, and based on the requirements for the state, for the county, for FEMA, is it's based on that program. So.
Steve, did you have something?
Sure, I have a question, just a comment. With a father of two boys in the school district, I look at this and I say, this is awesome. This is a well-timed, great piece of work that you guys are doing. So if you get to the point of needing anything from the board, I don't know if we would get to the point, and I don't know our policies well enough to know if we have something in the policy where we might even want to go back and review that. But if there is anything like that, count me in to help and keep us posted, because this is a great piece of work.
Okay.
Do we have our CERT involved in this also, our community CERT program? Are they?
It is actually CERT's exercise they're going to be doing in
I was wondering
May.
if that was the one that you guys were talking about.
Yeah.
Yeah, they do. They are required to do large disaster drills, a couple a year, I think, and so this is the one that they've been planning for some time. Just kind of happens to fall into place right now.
I agree. We had a training on this at our conference this summer, this fall, not this specific program, but a school-based emergency response thing, and it was something that we had talked about at a board meeting, and it's, I think, very exciting to have this start and get put into practice in our schools, and thank you guys, and thank you to the law enforcement agencies that are working with you.
Okay. Bus school security surveillance.
I don't want to know which one we need to go. In line with, obviously, we're talking about security. One of the things that we are doing district-wide to improve on the safety and security that we have, obviously for our staff, our students, and law enforcement, is to improve our camera system and make it usable. And right now, what I'm going to do is show you the flexibility in our current camera system. Currently, 3 of the 5 schools are on the system. You didn't get the one completed this afternoon, or we would have them all. But these are all live cameras right now in all 3 elementary schools. Talmadge will come on to the system tomorrow. The high school will come on next week. And so what you have is a series of cameras. These are all live shots. If there was one, oh, there's some action right here. So I'm going to... There we go. That's the Ash Creek cafeteria and hallway. And what the cameras are on the live at all times. They only record when there's motion occurring. So in any of these cameras, we have approximately a month that we can go back, get to scroll to that time period, pick up, record any information that we can use. And so a real valuable tool. And as I say, we're switching out the DVR today and tomorrow, and we're switching out the DVDs at the high school next week. What I'm sure is going to happen is as we see this information, we're going to, in fact, want to expand our use and add more cameras to it. We have not unlimited, but pretty significant capacity to add cameras at this time at all 5 of our sites. But it's just really kind of a neat thing to have. And from our aspect over here, if I wanted to look at Ash Creek, I can just drop Ash Creek over here. Now those are the Ash Creek cameras. If I wanted to look at IES, there's the IES cameras. If I wanted to look at Monmouth, there's the Monmouth cameras. This happens to be the office. I just increased it in size before I set this up to show you that you have great flexibility in what it is that you can set up. So you can go to any one individual, or you can go to them completely together. Now, just so you can understand somewhat the flexibility with the tool that we're talking about, obviously if I were sitting here, sitting at my desk, that would be what I had. But if I was walking around the halls with my iPad and I heard about an incident, I have the ability to do exactly the same thing. Okay, so here again, what I've got is I've got the cameras up, and I can access the same views that I was just looking at as I was at my computer. So as a principal or as a district administrator, we have the capacity, if we have an incident going on, to in fact access this information and be able to get it. And lastly, of course, it doesn't always happen. One of the things that I've worked hard with the group that are working on our plan, historically in the past, I would suggest that we've done a really poor job of planning for these type of events from this point of view. We always have a plan that works for what do you do when the kids are in the classroom. And I know at one point in time when I was a principal, we failed an emergency test because they said, well, you're not using the formula that is in this book, and it's a great book. We worked very, very hard on it. And I said, well, here's the only question I have for you. If you can guarantee me that the only time we're going to have incidences is when kids are standing in classrooms, that we will never have an incident before school, we'll never have an incident after school, we will not have incidences during either one of our 2 lunches, and nothing can happen during passing periods, then this works well. But that's 18% of our day is made up outside of this classroom. So 18% of our day, we better be prepared for the worst part of our day, because certainly in the classroom it'll work easily. And that's part of what is they're working on there with that plan. But if I happen to be, let's say, in out around, and I get a call telling me that I have a problem at my school, whether I have an iPhone or whether I have a regular phone, here again is exactly the same views that I just had. And so all of our principals now will have access to their buildings and safety within their buildings based on their iPhones, or their smartphones, their iPads, and or their computers at their desk. Another function is this, is that one of the things I neglected to show you on the first one is that currently all of the sites that you're seeing right now, that's a kind of cute girl right there. Yeah, the guy's ugly as heck, but the girl's cute little thing.
Yeah.
That all of this has already been installed and is on every computer, both in Independence Police Department and in the Monmouth Police Department. So as the officers have it on their laptops in their cruisers. So if they get a call to any one of our facilities, they have the ability to open up, take a look on camera, see what's happening before they get there, which certainly enhances officer safety and provides us with an additional security. So I wanted to let you see that that was happening. Excuse me. As soon as CalMates comes up on the system, it'll also automatically be in police officers. And then in the high school comes up, it'll also automatically be there. We're in the process of working with the fire department, because fire will have it as well. They just haven't been ready to download it. So we have reached out to those partners within our community, and those are the type of things we all have. Questions from anybody?
Excuse me, we don't have anybody monitoring the video feeds for any particular.
We don't have anybody monitoring the video feeds. Sometimes they're live in the high school if they're sitting there, or the principals might have them up or something, but they're not sitting watching them, no.
There are monitors in our offices that we can look at those, glance up at that type of thing. But as far as, actually sitting, I don't know. But the monitors to see that same display are in our offices as well.
Cease, did you?
And now I can visit with the YMCA about the fact that children are running up and down the halls at Ash Creek while their brothers and sisters are playing basketball.
According to them, they never have to.
Yeah. Because we can take stills from this as well. We can download a still. So.
I'm not on there, but you're coming anyway.
We were sitting back there deciding who was going to go first. And so I did, and yeah, I did whatever rock covers I did. Okay, I want to talk to you briefly tonight, please, about the progress that we're making in the contextual English language proficiency program that we started last year. As part of Buzz's initiative to have rich data upon which to make decisions, this presentation is all about that. So just a quick refresher, especially for those who weren't on the school board, as in the case of Jerry. We started this initiative last year with Western Oregon University in a partnership, taking the idea that, we're teaching these kids English, but it would be so much nicer if we could teach them English in some way that's tied to what they're learning in school versus a separate course. Teachers in how to do it with the cooperation of Western, and I want to give our teachers incredible credit for taking this on and learning how to do something that's very different. We've worked with our middle school and our high school people in the 8th and the 9th grade. Again, those teachers deserve a lot of credit for what they've worked with. We will continue to work with the middle school and high school in a sort of a sequence about, I'm sorry, I should sit closer, shouldn't I? Is this better? About the training. So we will, by the end of this month, probably have really good hard data for you on, is this making a difference in student progress? Now that's a complicated question because there are so many variables and we've been doing it for such a short amount of time. But the early reports we have from MES are so incredibly encouraging. We took the data from the 3rd, 4th, and 5th grade. That's what I'm going to talk about briefly. And those students, there were 15 of them, 58% of them moved one proficiency level. And you guys, that is a big deal to move proficiency levels, especially when you get to the higher levels of competency. It takes a lot of effort to move from, say, a 3 to a 4. Not so much to move from a 1 to a 2, and most of these moves were in the more advanced region. So the initial very, very tiny look at the data say this is really a positive thing. We measure it with something called the ADEPT, and that's a developmental English proficiency test. And it's essentially a test where a student responds to pictures. The lower proficiency levels point to where in the picture the action is happening. The higher levels answer in more complicated grammar. In your packets that Julie, I think, handed out to you, I've included the really pretty green striped one. I've included the English language proficiency levels, because as we go through the year and we talk about this more, it'd be, I think, really helpful to you folks to know what these things are when I talk about a level 1, 2, 3, 4, or 5. And so it's really important that we pay attention to where kids are in these levels and how quickly they move. We've also, along with this contextual ELD thing, we last year were invited to make a presentation at COSA conference in Eugene on our project. We have been requested to come back again and talk to the state of Oregon administrators about how our project is going. So it's exciting, it's challenging, and it's showing some results. I hope to be back here in front of you in March with results, and I'll tell the truth. Well, you'll see the results. Any questions on this?
Just a comment, kudos to everyone. Really.
Thank you. They really deserve a lot of credit. Go ahead.
All right. All right. So the components that Jan was talking about touched on one subgroup that we have, which is our English language learners. What I'm going to talk about is a broader picture. This is one of the initiatives that we started this fall that looks at supports and infrastructure for all students, and it supports the IBAS or IBASE with the columns. And so this idea, initiative that I'm going to talk about, is called the EBIS, or the Effective Behavior and Instructional Support Systems. And it's, I gave you a little two-sided thing last time that just kind of gave a general overview, and so I'm going to provide a little bit more information for you to see what we're doing in the district. Currently our EBIS team is made up of licensed classified administrative staff from buildings and the district office, and we've met several times during the year. And what we're looking at doing is creating a tiered framework for both academic and behavior intervention systems for students. We start at the district level, and then within buildings, they start to develop their systems based on what the district framework is that we create, so there's consistency throughout the district. Talmadge actually has been working with the positive behavior support systems, which is a type of the EBIS framework structure for over 5 years, they've been fully implementing the behavioral systems. They're now currently going to be working on the academic systems along with the elementary schools, and the high school has been working on the behavioral aspect of it this year. There have been several trainings at the state level. We had a small group of people in August attend a training with a Scaling Up grant through ODE that we're participating in that provides a broad overview of the tiered framework systems, and there'll be 2 more this year with that same grant. The high school's been participating in a high school, middle school, elementary, statewide PBS Tier 1 supports, which is how do you support behavior for all students in your schools. Several people, over 20 people from the district, will be going to a state conference at the end of this month on PBS, or the behavior and the academic tiered support systems. And what we'll be looking at is how do we encourage and get support from board members by providing information and having you come along with us. And so talking to some of you about engaging in that conversation and becoming a member of that group. The activities within these tiered systems is really look at how all students are progressing. And so this fall, we started with the first universal screening for academics, and we looked at math skills and reading skills from K-5 and 9th grade. And Talmadge is tracking the progress that students are making using the proficiency-based grading. Excuse me. So what the universal screenings are is that you identify what targeted skills you're going to assess for all students, and that all students take the same assessment at every school for every grade. So first graders, they all are taking the same assessment in certain math skills, and then between teachers, principals, buildings, and district, you can look at how students are progressing in certain areas. And so that was done in the fall, and we'll have, the second assessment will occur February, March, and then again in June, May, June. And the idea is to look at how students are progressing as a whole, and eventually as we create our tiered systems, we look at students that aren't progressing and how do we provide interventions for those kids that aren't making the progress that we want to see. And it's consistent throughout the district, so that's kind of the tiered framework systems. As we collect data, we'll be sharing those things with you in work sessions to give you more specifics. This is our first year of collecting data, so we're really looking at what works, what doesn't work, what systems do we want to adopt. So next fall when we implement, we'll have done the test year this year by gathering information. We're finding that not all tests are the same, so we want to make sure tests are the same, and then the data will become much more, what's the word? Right now it's kind of fuzzy. So it's not, yes, it's a little fuzzy because we have some tests that are different, some are the same, so we can't really compare across schools, or within schools, teachers can't compare with each other. So next year we'll use the information that we've gathered this year to have clean data to help really track how our students are progressing. I think that I hit our little bullets. So,
questions?
Any questions?
Can you explain this chart?
Yes. So the green folder, let me give you a little quickie on the green folder. The green folder is your folder to collect information on our universal tiered supports. We didn't have a label printer, and so we didn't want to write on it, but that's for you to start to put things, to build your own little resource system. The universal screening chart that is in that packet shows the table. Do you want to, thank you. Yeah, that shows which assessments were selected for building. So our kindergarten is using the ESGI, which is a system that they are tracking counting from 1 to 20, letter sounds, identifying letters. So from the kindergarten end, we're tracking 6 different data points. And so that's the system they're using. First grade is using it's an EasyCBM database where kids are doing the math, and then for first and second in reading, they're using the DRA, which is the Diagnostic Reading Assessment, correct? So that just lists the different manufacturers and the different assessment types that each grade level is using.
And this is the first year that we've done this consistently at the elementary schools?
Yes, so this is the first year that we're beginning an implementation of the universal screening. And so they did the fall round, and now they're in, starting today, beginning the second round of assessment.
Is the clarity here really that not everyone was doing the same kind of data collection before?
Yes.
So now this year is the switch to everyone using the same thing.
And teachers are still going to use whatever data systems they have in assessment. It's not that teachers haven't been doing assessments of their students. This is now more of, we're going to do the same, at least 3 times a year, the same assessment to see how our kids are progressing across the district. And so in addition to what teachers are already doing, this is an additional tool to look at comparability.
Anyone else? No? John?
Are the Common Core tests standardized tests now, or are they still?
So the Common Core that are listed, the CCSS, those are assessments through the EasyCBM system that are from that publisher's research shows that there's a correlation between how a student would do on the OAKS assessment, that they're supposed to be correlated. There's some people that would say that's accurate and some people that wouldn't. And that's kind of why really this year of looking, do we find this assessment or these tools that we're using, are they really effective and helpful for us and how we're going to drive instruction and support our students? Or is there something else out there that will be more effective?
But these are all purchased assessments as opposed to something that we've had to develop ourselves.
Correct. Yes.
Research-based and normed.
Right. And that's all, really this whole universal systems and the tiered systems is all about research-based and doing things that have best practice behind it, from curriculum to interventions.
Anyone else? Okay, thank you. Okay. This moves us to our financial program reports. Cease.
Again, I have about a half an hour. I hope you don't mind.
I do.
I have a couple of brief reports for you this evening, as we went into some detail last time. The first report that I have for you is actually our quarterly risk assessment. This is a just kind of a loss run on our different types of insurance that we carry, so that you can see over the last, in this case, we're up to 6 years worth of information about the number and type of incidents we have suffered and the amount of money that we have for these incidents, and then our loss ratio, which is very important because, of course, that determines how much our insurance company wants to charge us for insurance in the future. If we pay more in premiums than they pay out in claims, we're in good shape. And if we pay out a lot more in claims than we paid in our premiums, they're going to be raising our rates. So I won't go over these in detail, just because luckily a lot of them are kind of zero. Our first
Don't mention that word.
What?
Don't mention that word. Okay.
Auto liability, we have had no claims to date, and this insurance year, this policy year, we're on a July 1 to June 30 year. So in this case, policy year is the one that began July 1st of 2013. Also our auto physical damage, no reported claims on that. General liability, those again are just like our liability claims that we have around in our own personal insurance policies. We've had a couple of incidents. One was an employee's car was damaged in our parking lot, and another was a patron at a basketball game, a community patron who stepped off a curb and was injured. And we looked at that and found out that we had some low lighting issues and things, and so we did accept that claim because it really did appear that that could have been caused by some of the way we had things set up. So have a couple of small claims there. Property claims. Those of you who remember about where we were sitting on our property claim last year, where we were a little higher in our loss run ratio. We'll note that this year to date, no property claims. And I'd also like to point out, again, with all those knocked on woods and fingers crossed things, that we've had a really, we've shown some real improvement in our workers' comp incidents so far this year. That a lot of the training we've done, more frequent inspections, we've called our risk management team in from our insurance company to do more proactive reviews for us, and that appears to be helping. Greater emphasis on safety so far this year, and nothing to report there for your concern. So that is looking good, our risk analysis on our insurance.
See, how long does it take for the insurance rates to go down when we start having claims? Or fewer claims?
I will tell you, I just today got our initial budget projections. Our insurer actually sends me sort of where they think our workers' comp might be going, and they actually are predicting a little downward tick for next year. So, and that's partly, of course, workers' comp is so based on statewide rates, things like that. There are some things that aren't in our control, but we had some very serious jumps, or raises in our workers' comp experience mod, and that appears to be leveling off, so hopefully we can maintain that.
And our other liabilities have much smaller numbers, but same
Yes.
thing, it's gone up a lot as we have bigger claims. So assuming in the next couple of years, if we keep up the good behavior, it should go down.
Exactly, then that would start to lower. Exactly. Any other questions about the insurance stuff? And then, again, just sort of a summary, and this one being by major function. And I did manage to get those sort of descriptors in there, so you don't have to remember that the major function 1,000 is our instructional services. The major function 2,000 are support services, 3,000 is community and enterprise, 5,000 is debt service or transfers, and then 6,000, those are our reserves or contingencies. And I'll note in the 200, I'll also note the date of this, January 27th. This does not include the payroll encumbrances for all of the adjustments that we're making due to settling the license contract. Our Lissa Zyman's and Marcel Rossi in payroll have done yeoman's work in trying to figure out all of the ramifications of that settlement, and we do have, I think we signed off today on the adjustments. I got my one question answered. You got yours done. So we are ready to make those payroll adjustments, so none of that's reflected here, right? Either the back pay portion, the retroactive portion, or what we anticipate for the year. So please note that. The other thing you'll note in the 200 funds, which of course are all of our grant funds, and you see those minuses there, and a couple of things are happening there. One, of course, remember this year we knew that federal funds, we were being cut because of the sequester and the federal funding situation. So we were guessing at about how our people's time would be allotted, basically. We said, gee, these folks are kind of going to be working in title areas, or they'll be working under the federal special education grants, but we didn't know for sure when we got those funds, because of course that year starts in October. It doesn't start in July, we get those funds in October. And what we do this time of year now is sort of really move people around based on our budgets. So some folks were coded to be working in the special ed particularly is one of the big areas. Grant funds, we'll have to be absorbing those folks back into the general fund to correct those balances. So it's a little bit of a balancing act that happens every year, the first couple months of the federal fiscal year, and that's reflected here. So that will be corrected, but that will, again, be a little bit bigger hit to the general fund when we do that. Getting a better handle on these as we go, but just sort of generally where we are in our overall picture of things. Any questions?
No? Okay, thank you. Okay, Buzz, now.
I've got 3 or 4 things I'm going to provide you some information on, kind of report a little bit on. A couple of them are quickies, and so I will, I probably don't need them all then because it's not black. Oops. The CBIS, and I forget what CBIS stands for. It's an acronym in the federal government. I'm sure you're surprised that the federal government has an acronym. But what it represents is the international program that we've been talking about with regards to Western Oregon University. And what happened is that we have been approved by the federal government. So we are now an F-level school district, the high school, excuse me, is an F-level school, and it's able to accept foreign students. And so we will be now finalizing with Western Oregon, and assuming that that all comes together with Western Oregon, that has nothing to do with it. Our assumption is that we will be hosting somewhere in the area of 20 Chinese students at Central High School next year as part of this program. So the CBIS did come through, and that's a positive thing for us to move forward with as a district. Also, I let you know as a board that the leadership teams at the schools have been formed and identified, and many of them have met. We're in the process of now identifying and crafting the district leadership team, so those are now up and operational. And I think that's particularly important as we'll move into a couple of other things here with regards to information I want to share with you. What I was asked to do at the last board meeting, and obviously we talked about it, it's been something we've been working on for a long period of time, is taking a look at our class load situation. And more importantly, from my aspect, was creating a procedure so that we understand how we are going to address these situations. And, you know, one of the things about class size is that when you're lucky, you can predict in the average that you have, first of all, balanced classes. You know, you don't always have the same number of children born per class in a particular area, so it's at times very difficult. The numbers that I have in the report that I'm showing up on the board were for the week of January 14th. And there are some imbalances, and I'll talk about those here in a couple of minutes. Key thing I want to do here, though, is identify we do have some areas of concern. We also, though, are trying to work on a process, and we began a process. We have vetted the elementary school component of it has been vetted by the elementary school principals. We're going to go back with them to complete that. We'll then vet the secondary part with the secondary principals. Once that's done, we'll take it to the leadership teams so that the leadership teams have their opportunity to vet it and work at it as well. And what that process will be, excuse me, I apologize for hacking at you. It's a lot better than it has been, but we're in week 6 right now. But first of all is, how do you define average? Because it's a great question. What is average? And in most cases, what I think has been done in the past, I understand from the research I've done and the conversations I have, it's been about 8 or 9 years since our district has in fact, reached back and had a procedure that identifies and talks about this. So over the last, since the time I've been here, what I can tell you is that the way we have figured out average has been you take the number of classes, you add them together, then you divide it by that. It's a regular, simple, probably 8th grade. Huh? Yeah. 6th grade. Used to be 8th grade expectation, now 6th grade expectation. And averaging. Well, to me, that's not a fair number. And the reason it's not a fair number is because if you do that without looking at the outlier classes, you have a class of 7, and if I take a class of 7, a class of 20, and a class of 40, and I'm add them together, I get a reasonable average, and I never look at the class of 40. So I think you have to eliminate the outliers. And then in the various levels, you'll have outliers that are just normally a little bit larger. So at the high school level, as an example, I've eliminated all of, in the procedure, the draft procedure that we're working on, I've eliminated the music classes. Music's an interesting one. It can help you and hurt you because you'll have a performance choir of 10 or 12 and then the choir of 112. And so it really goofs up the averages there. I've eliminated PE, so I've taken the special education, any of the outlying classes in the new procedure I've taken out of it. Currently, here's at the week of January 14th, whoops, it came down.
Yeah, just did it.
No, I didn't do that. There you go. Currently, in the week of January 12th, here's what I can tell you. Of the 20 classes at MES, I used 3 very ways to identify them. I said they were either okay, which meant they were on target, or they were watch, which meant they were within target at 115% of target, or they were concern, which was over that component of that. And at MES, of the 20 classes, 9 fall in the okay area, about 45% of the classes. 4 of them are in the watch area, 7 are in the concern area. The average currently, using the old model of excuse me, of average is 25.75. However, we have an outlier at MES is one of the places we have one of those outlier classes, which is a very small class. If you take that class of 7 off, it goes up to 26.2. And I think that outlier has been in the past, has gotten us in situations where we talk about average and it's in a different situation. At IES, the 16 classes, 8 of them fall in the okay category, 4 are in the watch area, 4 are in the areas of concern, and over here to your right are the numbers of some of the classes where they're concerned. So at MES, you've got in the watch area, you can see here, you got 3 that are 28 and 1's at 27, 2 are 29, 3 are 30, and 2 are 31. And at IES, you have the watch and concern also spread out. At Ash Creek, of the 20 classes, 11 are in the okay area, 5 are watch classes. The reason I have 3 and 1 like this is because there are really 4 classes that we're concerned about. One of them is a kindergarten class, so it's 24, but it's bigger than 22, but it's really hard to figure into that formula. So I had to kind of show it in parentheses. It's a concern, it's something we're talking about, but it's a class that's a little bit bigger, so that's why we have it shown in that fashion. I'm missing the class data here. Yes, I am. I didn't see that until I opened this up. And I think the largest, you have one class of 30, don't you? Craig is now in this?
K5?
No, yeah, K5.
2.
2 classes of 30.
Yep.
Okay. 2 classes of 30 at the K5 area in Ash Creek. When you look at the average that we've considered in the past, it's 25, 75, 26, 2, and 25. At the middle school and the high school, you have some different situations. You have 120 classes at the middle school. 41 are okay. 66 rest in the watch area. 13 are areas of concern, and that the largest there really gets into the area of 38. You have 7 at 32, 3 at 33, 2 at 33, excuse me, 3 at 34, and 1 at 38. And at the high school, 159 classes, 88 are okay, 52 are in the watch, 19 are in the concern, and you do have a class of 41. You see the 19 right here. The reds are the concerns. Both at Talmadge and at the high school, I eliminated the PE classes. I eliminated the music classes. I eliminated the special ed classes, so that on one end I was not negatively impacting on the average by having the sped lower classes in there, and on the other end I wasn't doing the same thing with the larger PE classes. So in my mind, you have to look at two different averages. So even though it's not been the way we've done in the past, that's the only way as a former high school principal that I know how to really reasonably look at a high school. So we're reasonably looking at the high school and the middle school right now. We have averages of 27.1 and 28.9. Now, when you have classes in the high 30s and low 40s and still have a average of 28.9, I think that leads us to understand that we have some smaller classes. And I think those are things that we have to address. Us, as I'll be visiting with Greg, and Greg as he visits with the staff, are there ways that we can use scheduling or other issues or other methods to develop a way to maybe be able to increase the size of those classes and get rid of the 30s and the 40s. That's the key to what we're looking at. But from a report as to where we were in the week of January 14th, that's a report as to where we are. Questions about that?
So is this a report that we'll see like every couple months or something?
What you'll see when I'm putting together as a proposal, and I've been working at it for about 6-7 months right now, is that once we have all agreed, and again, I want to vet it through the leadership team so we have teacher input on that. Once we've agreed on not only our strategy, or excuse me, our targets, our definitions, and our strategies, then what we would do is we would record on a quarterly basis to the board based on, that targets and things. And so you'd get a report right after school started. You'd get a report then on a quarterly basis to the board point of view based on our agreed upon procedures. And, procedures, class size is a tough thing sometimes to work with at the secondary school in particular when you have programs that you're working to save and things of that different nature. But we will we will know and use, in my estimation, use the categories of okay, watch, and concern, because I think those are telling us what it is that we want to know.
And those are all based on a target class size of 20?
Right now, the target class sizes, I believe, at the elementary school was 25, and the middle school was 25. I know in the work that we've done so far, our targets at the middle or at the elementary school will probably be multiple targets now. One target for primary classes, a second target for intermediate classes, and then as we work through the high school, we'll work through some different stuff or different things there as well, I'm sure. Then the second thing that I would like to show you, you have in your packet.
Buzz, could I just ask one question?
Sure.
At these schools, excuse me, where you have the big numbers in some of the classes, when I was a school teacher many years ago in a high school, we were on what they call a 5-period day. The school day was 6 periods or 7, but the teachers taught 5. Mm-hmm. And some of us volunteered to split a class in order to get substitute pay for that 1 extra hour if we taught an extra period. Is that possible, or are all the rooms being used now in the
Well, I
buildings?
don't think all the rooms are being used here, but I think there's two things that always concern me about that. Number one is not only if we're gonna talk about class size, we also need to talk about class load. And while it might be palatable to compensate you to buy out a prep or something to do something like that, I'm gonna suggest and ask the question, is that the reasonable way we wanna set up our system? Because that's not addressing class load. That's addressing class size. And I think there are two separate things there that truly are items that need to be addressed. But I think we will put all of our potential options in a menu of choices within our procedure once we've all agreed to it.
No? Nope.
Yes, Steve.
How should we be thinking of this process that you're introducing? And I know it's good work, really good work. I like this definition, really, it's come a long way, it's good. But how should we think about this as we're coming into the budgeting cycle?
Right now, what we have the high school, or excuse me, the elementary school principals doing is fitting our model to our schools, to our building, and to our staffing. So, I mean, those questions, we will have some preparation for you once we're able to go through that process, but we're matching our district to that budget right now.
You're keeping that in mind, trying to get some initial kind of output from this to feed into essentially the budget discussion.
One of the things that we wanted to make sure we did, though, I think we got to where I know, because I was a principal that had the same thing happen to me. You got to where we got because of the budget and choices that you made within that, okay? So I really have asked everybody to not have the budget in mind when you're developing the procedure so that you're not driven by outside influences. Now, that may impact it differently, but at least we'll get the ability to look at it in a reasonable sense.
In other words, we'll have a district stated goal and strategy, but the reality is what the budget will afford us.
Right.
And then you determine the funding level and say, well, we can do these first two strategies, but we're not going to quite make it.
Right.
But you want to develop the strategies without those maybe artificial constraints.
Good.
When we're looking at the different numbers and things like that, what are the percentage of these teachers that have aides, maybe with the higher numbers?
Have aides, what kind of aides?
Like an instructional aide with other students that are in the
And
classroom?
that varies from building to building.
Does it?
One of the things that we see as we look through it, I think, is we don't have a set pattern for a definition of assistant time. Aides, I think of teacher aides at the high school, which means it's students. And sometimes teacher aides and students are very good at getting coffee but they're not instructional aides. So I think we have to look at instructional aid time, look at situations, and you look at, frankly, teachers and situations. I can tell you as a teacher, I've had class loads well over 30 that were a piece of cake, but it was a class that was a piece of cake and a group of kids that were a piece of cake. At the same time, I've had classes of 24 that my head looked like Ben's.
There's hope for you.
The other component that we have to balance into that is that as we've all learned, and as you go and look at the research on class size, there's an important component that it's effective instruction. That's the key component. That's by far research-based more important. The most important thing in learning. However, at the same time, you have to address issues of productivity and things of that nature. So as we vet these things through, we're going to vet them through to get input all the way down so we have some idea. And then, I'm assuming that, we'll take that work and make it reasonable with regards to what the state provides for us.
One of the pieces that we have that's missing on your graph, Buzz, is the maximum capacity classroom-wise of each facility too.
We'll get that.
Yeah.
We'll get that. But here again, through the district, you've got classrooms like over at IES, there's some classrooms that I have to stay overnight so I can get to the other end.
Right.
I mean, they're huge. And then as you go into some other buildings, there are significantly smaller ones. So very tough to make overt statements with regards to facilities, because that's just like averaging a number. If you've got a classroom that would hold 45, are you going to put 45 kids in it? No. So I think you have to look reasonably with regards to what our parameters are. So I would prefer for us to get there without the buildings and or the contract restricting us. Now, I know we have buildings and I know we have contracts. I'm not foolish, but I just think it's good work to look at.
I guess my thought is when you see, you know, the classes you're watching and you get the numbers up over 30, the first thing we think about is how can we affect that next year? You know, suddenly we have some funding available, if it were available, and you decide to do something and then you don't have a classroom. See what I'm saying? I'm thinking that component.
We're going through all of that. That's why they're taking this and putting it through to the building. Okay?
This is great.
Because as you'll see as you go through there, the goal is class size in the central school districts will be at or below the class size targets established in the budget narratives for a school year. So that would be the goal of the work that we're doing here. The assumptions is that the average, we would change average class size will be determined by using the class size of each certified teacher in a school who was assigned a class, with the exception of special outlier program classes, which are normally quite small and may skew an average. So again, we'll get the outliers out. Okay?
Right.
Rounding, we always round up, because I'm not Solomon, I'm not going to cut the kid in half. So we always round up so the whole kid gets to move and not just 2/10 of him or 8/10 of him. You know, if I was a kid, I'd at least want to have 8/10. I might have a chance to live. But as a 4/10, I'm in deep trouble. So we're going to round up just to save the kid's life. As a guideline within the district, at this point in time, we would look to not create new classes unless we're at least minimum had a 15 in there as a minimum for new classes. And that, again, we're trying to also not make absolutes here. Because as you get into absolutes, absolutes get you in trouble. You know, again, myself, I used to have a program where the Medford School District had a cap on my class. Well, every now and then I snuck over that cap because kids needed to get in. And I got in trouble for that but it was really easy to do and they were good kids, and so why not? You know, so absolutes are not really good because you don't want to hammer the kids or hammer a teacher. Class size, you know, consideration, again, acceptable, watch, and concern. You know, acceptable would be at or below the targets. Watch would be less than or equal to 115% of the target. Excuse me. And concern would be between 115% and 140% of the target. And the current elementary budget targets are 25. And presently, what the elementary school principals have looked at is 24 K2 and 26 3-5. And then we go on to talk about a policy and procedure, and I won't read it to you because you have it in front of you. And then what you see in the stars or the asterisks, thank you. And the asterisk, each asterisk, each one of those little starry things is a potential strategy that we might employ to help us with class sizes. From adding instructional support time, as Steve was talking about, to maybe there's some software that's involved, maybe there's some flexible grouping we can talk about. You know, maybe we hire an additional teacher but not give them a specific class, so they're doing a component. I mean, there's a zillion different ways to look at it. What we're going to do is vet and create as many of those as we can in the process. At the secondary level, we haven't done nearly the vetting yet. It's too bad that Becky is gone, but somebody tell Becky at least. At the secondary level, again, average is defined in the same fashion as we defined it. Rounding is the same way, because even when they're older, as much as you'd like to cut them in half, you can't. But then we have to look at the middle school and figure out what that target should be, should it be different for the different grades? We have to look at the high school, and then both at the high school and the middle school, we have to look at our counseling component. Because truly, I would tell you that a counseling load of 350 is a very heavy counseling load, but we're not anywhere near 350 at this point. So I think we have to look at those things, and I will be meeting separately with the secondary folks to go through and vet this and create the addition component to that. So I wanted to show it to you so you have some idea of the work that is going on and has been going on for several weeks to address this. Questions from anyone?
I think that pretty well covers it, besides you're not going to be able to talk to each other. So do you have more things to say?
Well, I hope not.
Enrollment.
Oh, gosh darn enrollment, that's right. Yes, I do. And you also have your enrollment report in front of you. You can see at the first sheet shows you that the elementary enrollment is back up a little bit. Went from 1318 to 1321. You can also see that secondary, we had a little bit of a slip, just 2 kids, 1584 to 1582. And so, from a district point of view, we showed an increase of 1 student. So, information is there with regards to that.
There's for everyone, no questions about that? Okay.
Thank you, guys.
That moves us to the board report, and I'll just briefly remind you about the fact that we don't have the Lighthouse next Tuesday, but we do have our IBAS work session in the same time, same place. And that information about the IBAS is here for us to look through. And then also, if you know folks who are interested in being on the budget committee, we have a couple of vacancies. And it's important to get people on that committee. So, the information, do you want to add anything to that, Cease?
I do know that our Zone 5 representative is going to be reapplying, but
Okay.
our Zone 4 was actually an out-of-zone appointment.
Right.
And I'm not certain that he will be continuing Ken Juski, so that's definitely one that we would want to focus on that area to try and...
So say that one again, which one's?
So
Zone 4.
Steve Milligan is Zone 5, and he is interested in reapplying for his position, does intend to.
So Zone 4, we're looking for somebody in Zone 4.
That's my belief, because Ken Juski was an out-of-zone appointment,
Right.
so he would not be eligible to continue if someone else applies from that zone.
Right. Okay, this moves us now to the consent agenda, which, am I right? Yes, okay, which requires a motion.
I'll move that we approve the consent agenda. That is.
Second. It's been moved and seconded. Any discussion? Comment? Okay, hearing none. All those in favor, please raise your right hand. Opposed? Passed unanimously. Okay, moves us to our business agenda. Our local service plan resolution, WSD. Buzz, can you talk?
Yeah, the WSD annually, of course, they bring their service plan to us. That does not mean that we have committed to anything. What this is their menu that they're providing us. It's the same menu that was provided to us last year. We amended that menu a little bit mid-year, but it's the same one that it was amended. And so I present that to you. We, by law, are required to either challenge that or amend it or approve it before March 1st. So.
And then we actually, as a district, don't vote on that, what we're going to Is that for now?
No, this is just, yeah, we would have to vote.
This is just the menu, right?
This is just the menu. We're not ordering anything.
Right.
It's just the menu.
Okay.
But right now, we're on the menu for $950,000. That should be what we get, that should be the value we get from them.
Boy, I'm gonna tell you right now, the number, we're gonna get a percentage of dollars and cents.
Right.
That dollars and cents number is changing, so over these last, recently we got numbers with regards to the changing with the poverty numbers.
Yes.
Unfortunately, there were several thousand students that districts forgot to report because they forgot to report their charter school students. So there's several thousand students that needed to be added to that, so some of those adjustments will change. In other words, I say that those adjustments come off, so will it be 950 or not 950? It depends. It's dependent upon the whatever the number is for student support. But that's generally, yes.
So I was just trying to understand.
It's kind of like a double play baseball. It's going to be in that area.
But basically, the way it works is this money comes to the ESD from the state, and then they're dividing it up amongst all of their customers.
Exactly.
And so effectively, they're getting $950,000 or something like that, that we should benefit from, I guess.
And we have the opportunity, and of course, as it progresses, because of that recent law change, we have the opportunity to either transit those dollars or participate with them. And next year, I think we can transit up to 75%. The following year, I believe we can transit 100% of it.
Okay, is there a motion for this?
I will make a motion. I need some help with the wording here to make sure I get it, because I think we're not approving any kind of financial commitment. So
We are not.
I'll move that we approve the local service plan resolution for Willamette ESD as presented in our board package.
Second.
It's been moved and seconded. Any discussion, further discussion or comment? No? All those in favor, please raise your right hand. Opposed? Passed unanimously. Okay, this moves us to our adoption of the budget committee calendar. Cease, do you want to speak to that?
Yep, so the very last page of your packet is the proposed amended calendar that we discussed last time. This would be an official adoption. That would include our budget workshop on the day of your board meeting, March 3rd. Basically just sort of talking about general direction. Hopefully if we have anyone interested in being on the committee prior to that, I would be spending some more significant time with them, explaining the budget process, and Don and Jerry, as new board members, I'd be glad to work with you individually as well, getting you up to speed on this. But then that would include our first actual budget meeting on April 21st, and our second required meeting and approval of the budget on May 19th. So we'll come back to the board after June board meeting for board adoption.
Okay, this too requires a motion.
I move that we adopt the budget committee calendar as presented.
Second.
It's been moved and seconded to adopt the calendar. Any further discussion, questions?
Just a quick
Steve?
question, Cease, on the March 3rd board meeting
Yes.
workshop. Is that will it be just a part of your update, or will we start early and do a special?
Start early, probably just 6 o'clock. We'll do a sort of brief introduction of the outlook and values that have been determined, and that really is all going to be developed at that IBAS workshop. That's where we did think a lot of the budget direction is going to come, because of course that's all tying into our students' achievement goals. So a lot of that work will be done at work session prior to that, as far as general budget direction, values, and vision.
I have a question. If the presentation or this is made at the board meeting for all of the budget committee members, you will have are they going to be invited to this, or will there be a separate, or?
No, well, they'll be invited to attend that meeting.
Okay.
Because we'll have to have the workshop sort of first, and then they'll be, we'll be selecting them after that. So if
Right.
we have multiple candidates,
Okay.
then we can do that. I'm not anticipating we'll have multiple candidates, but, and again, as I did last year, we had one new committee member. I spent significant time with him prior to him even applying for the committee. He was just really interested in the process, so I got to really describe the process to him. And I'm glad to do those kind of individual discussions so that we've got everybody kind of on the same page as far as understanding how to read the budget.
Right. Okay. What else? Okay. All those in favor, please raise your right hand. Opposed? Passed unanimously. That moves us to comments by individual board members. Steve Mosier, would you like to start, please?
I would like to thank everybody that worked on the budget stuff this month, getting stuff ready, because I know it's going to be a long process, because not only did we complete the contract, now we're starting the budget process, and I know you guys have been very, very busy. I want to thank the teachers for kind of staying the course, and we got through all this, and we got lots of things ahead of us. And like I said, just a month or so ago, it wasn't too long ago, that I said, good Lord, we got to start the whole process over again. So, another day.
So, thank you. Mary?
I too would like to thank the teachers and our bargaining committees. They did an outstanding job. There was one phrase that kept coming up that I was very disappointed in, and it was that we did not respect the teaching staff of this district, and that is so wrong. I, for one, hold the teaching staff in this district with high regard. Thank you all.
Very quickly, I want to highlight an event that I attended last week, the retirement party for the Chief of Police in Independence. But the reason I wanted to comment on it is because, once again, a call was sent out to kids in our community to come and do something, and they showed up. And we had Main Street Choir come, and they sang several songs. And we had, in this group of people, we had representatives from different agencies from all over the state. And several times I had people come up or heard comments made about how wonderful they were, how well prepared they were, how well they presented themselves. And I think that that says so much about our kids and so much about Mr. Witt, and just the always, anytime a call goes out, our kids show up, and it's amazing, and I love that. I think our board meeting tonight had a theme of the health, safety, and well-being of our kids. We see that with our safety plan implementation. We see that with the proposal of a student health center. We see that with the opportunities that our law enforcement and fire and the district itself to be able to help monitor what happens in our schools. And I think that in all of those things, and looking at class sizes and looking at what we need to do for our kids, it's refreshing to get back to the business of the safety, health, well-being of all of our kids. And I just appreciate that we've gotten to highlight that tonight.